As we all learn to navigate and find clarity amongst the chaos that surrounds us, we know that stress levels are elevated. Even in families with healthy coping mechanisms, margins are thin. As we practice social distancing, children are not in school, they're not in church, and they're not engaged in their regular after-school activities. Professional reporters are not able to assess their well-being on a regular basis. And for many children, home is not a safe place. Children in our community need your help now more than ever. Child abuse knows no boundaries. While we are blessed to live in an amazing lakeside community with great schools and a family-oriented environment, we are not immune from the tragedy of abuse. Research from reported cases indicates that 1 in 5 children are at risk for some form of abuse, be it physical, sexual, neglect, witness to domestic violence, or witness to a crime, all before their 18th birthday. The Center for Disease Control estimates that children who suffer from adverse childhood experiences like abuse or neglect equates to $80 billion in healthcare costs. Yet, child abuse goes unacknowledged and is often an unrecognized epidemic. It's easy to teach our kids about stranger danger, yet the sobering reality is that over 90% of victims know and either love or trust their perpetrators, thus making it difficult to recognize. In fact, perpetrators hide in plain sight. We opened our doors for full services 2 years ago this month. At that time, we joined a network of 69 other CACs, now 71, across the state, all uniquely designed to serve our most vulnerable citizens, children. In just 2 short years, we have served 775 unduplicated children and their caregivers, offering restoration through safety, justice, and healing. Last year alone, we worked with 397 children and their family members in our community that were confronted with the tragedy of abuse. The following direct services were offered: 187 forensic interviews, 248 family advocacy services were provided, 860 mental health sessions were conducted, and 255 cases were reviewed. Let me give you a glimpse of what those numbers really mean. The following are examples of what we've experienced. A group of siblings proclaimed what a great day it had been after several hours at the CAC during their interview process because they got to eat. We looked into the eyes of a 13-year-old boy whose overall demeanor was riddled with defeat, having spent the majority of his young life in the midst of domestic violence. We offered support to a teenage girl as she disclosed sexual abuse to an unbelieving parent. We observed a 10-year-old boy remain avoidant after having witnessed a murder-suicide. Siblings embrace in tears as they took a united front and finally agreeing to speak out against their abuser. And a young girl began a new life with a new family after losing both her parents to a tragic incident. These children go to school with your kids and grandkids. These children wait at the bus stop in your neighborhood. These children are in your care at church. These children are active in gymnastics, dance, soccer, Girl Scouts, Boy Scouts, academics, social media, and may even live next door. While these young lives are touched with undeserved tragedy, these lives are also being restored. Each week we get little glimpses of healing taking place. Each week these kids walk through our doors, standing a little taller, chins lifted a little higher, eyes a little brighter, and a smile just a little bit wider. Each week, we hear indications of healing taking place through the laughter that spills down our hallways as they go to and from counseling. Refusing to acknowledge a problem does not make it go away. Children deserve to live lives free from intended harm. When that does not happen, we stand in the gap. With access to the Children's Advocacy Center, 397 children and their families received critical and essential services last year. This is why in April, we go blue. We go blue for kids to create awareness. We help bridge the burden of their past with a future journey instilled with hope and healing. We go blue to help kids currently suffering in silence in hopes that they may find the strength and courage to say something, that they might know that there are people here to help them. Your support helps ensure that those services are readily available. Together, we build a healthier and a more resilient community. Together, we heal little hearts and restore lives of future leaders. There are ways everyone participating tonight can help. If you would like to learn more, visit our website, therockwallcac.org. The website again, rockwallcac.org. There, you'll find tools and resources on coping through this pandemic, opportunities for volunteering, and you can also request training for your business, social group, or youth organization so that more people can learn to recognize signs and symptoms and know how to report. In Texas, the child abuse hotline is 800-252-5400. If you're joining from afar, look for a local CAC and look for ways to engage with them. While you do not get to see their faces or hear their voices, on behalf of the 775 children and families we served in the last 2 years, I extend a heartfelt thanks for your support for the work that we do to build a healthier community. Your presence here tonight helps create awareness. Further awareness coupled with education is the link to prevention. Our goal is to reach every child that needs us, provide every service recommended for them, and make every effort to offer the highest quality of service available. Let's go blue for kids.